I do think it is a really exciting time right now for potentially intervening to save beta cells. And I feel like we all can identify those patients with type 1 diabetes, kid or adult, but you can tell which ones have functioning beta cells. That the diabetes is just a little bit easier to manage. They're not having as many lows and highs. It's just easier. And, I think that it's what I would want for my own kids to have to preserve those beta cells and have that buffer as long as we can. I also think, and I feel very strongly about this, and I'll tell it to anyone who will listen, between the ages of 18 and 23, this is a critical life stage in young adulthood. And we already know that in general, type 1 diabetes, they have the highest A1C, they have the greatest challenges because, kids are going off to college, they're getting out on their own for the first time. They don't have a parent who is making sure they're taking all their medications. And when someone gets the diagnosis of type 1 diabetes during this age range, it is really, really hard. I mean, I've had kids have to drop out of college so that they can manage everything. And it is so challenging. And so if we are able to intervene to, lighten that load, to either push off the diagnosis until those frontal lobes had more of a chance to, mature, and decision making improves, and people and these young adults are more established and better able to manage this new healthcare challenge. If there's anything we can do in that window of time, I think that we should. And so I precept fellows in the transition clinic from pediatric to adult diabetes care here at MGH. And this window I think is critical. So I think that is a huge priority for the field as well.